snake bite kills more people than many other serious diseases in India. We are not aware of the snake bite. We are walking in the night, walking in forest, walking in built-up areas which are undisturbed for a long time. You may come across a snake, trying to catch it, trying to beat it, trying to disturb it. Definitely person will get serious snake bite. Important medical journal Lancet reported in 2020 that half of the global snake bites happen in India. Every year we face approximately 1.2 to 1.8 million snake bites. 50 to 60,000 deaths annually happen in India because of bites from poisonous snakes. Now the problem in India is we have very limited access to timely medical management. In many villages, in rural areas, forest areas, people succumb to snake bites. There are hardly any roads to reach out hospital because one has to reach the hospital in the golden hour of management. That is, in the shortest period, it is very easy for medical professionals to save a person from a venomous snake bite. And we do not have many facilities to combat snake bite victims. For example, not many hospitals are equipped with anti-venom. People in villages, they don't even know that there is anti-venom exists which can save lives of people from poisonous snake bites. So there is a tremendous lack of awareness among population. Although there are societies like Friends of Snake Society and there are many other societies in country, they are doing their job in the best manner, but still it is very far from reality. You must understand how serious snake bite can be and how it varies from one species to other species. For example, a well-grown spectacled cobra can inject only 5 to 8 ml of poison in a very wet bite, we call it. That means a proper bite. But a common crate can inject only 4 to 5 drops. That means the intensity of poison in the venom varies from one snake species to other snake species. So crate needs only few drops to kill, but cobra needs at least more than 5 ml to kill a person. This all depends upon the poisonous chemicals which are there in the venom. If you see geographic distribution of most of the snake population, we find in urban areas rarely we come across snakes. But in the rural areas, marshy lands, grasses, forests, fields, agriculture areas, especially paddy fields, there are so many places where snakes can hide and they breed. When we step upon them, disturb them, they can bite. Which are the states which have serious burden of snake bites? First is a UP. In order of merit, Bihar, Jharkhand, Odisha, Madhya Pradesh, and finally Andhra Pradesh and Telangana. Lastly, West Bengal and Tamil Nadu. We do not know exactly why these particular areas of the country are having more poisonous snakes and why people die there. There are a lot of geographical factors, good conditions for snakes to thrive. So there are so many factors. Remember always, snakes are cold-blooded animals. Their body temperature changes according to environmental temperature. They are not like humans who can maintain a constant body temperature. In the monsoons, what happens? Residing areas will be flooded with water and they become suffocated. Higher humidity makes the snake very uncomfortable, and also it's a breeding season for snakes to come out in search of their partners. Say around between June to September, we come across large number of people bitten by snakes. We have very serious snake bites which are fatal in India. If we talk about in order, Russell's viper, Indian cobra, common crate, saw-scaled viper. In fact, 2 vipers are more responsible. Although king cobra has maximum amount of venom, king cobra bites are not very often as we come across Russell's viper, cobra bites and common crate bites. So these 4 are the big 4s and which are responsible for major deaths in snake bites. You can see these beautiful pictures, a well-grown spectacled cobra and a crate, and you can see both the vipers. So these are the major contributors of fatalities due to snake bite. Russell's viper, and he grows more thicker. You can mostly see in the grasslands, farmlands, scrub forest, and also stony areas. There are a large number of areas of India Russell viper thrives. And remember, this venom is hemotoxic. It can cause damage to your blood, cells, tissues, muscles. Any tissue, it can be dissolved in Russell viper poison. And slowly the poison can cause severe damage, swelling, bleeding, kidney failure, liver failure, and multi-organ failure and death if not treated in time. Cobra is the most common. We see snake handlers, snake catchers often display Indian cobra. We pray it also. It has a neurotoxic poisons. That means it affects on your brain and nervous system, and also to a certain extent hemotoxic also. It also affects on the blood cells. So they bleed, and the respiratory centers, and there are other centers in the brain, they get damaged because of the neurotoxins. And these snakes are widely available in India. Forest fields, paddy fields are very common place for normal Indian cobra, because he goes into the fields in search of rats and frogs, and the symptoms can be very painful, localized, swelling, but not as painful as viper. This can cause serious paralysis, respiratory failure. Large number of people are bitten by Indian cobra. Next is the most important snake, which is very, very lethal. I can say most poisonous snake in the country. It's a common krait. Common krait and a banded krait. There are two major species of kraits we see commonly. Both are very, very seriously neurotoxic. Person can die within minutes to half an hour. It can paralyze your respiratory system, cardiovascular system, and impending death occurs within no time. And few drops of poison is enough to kill a person. And they are available widely throughout India, especially around the water bodies, paddy fields. Sometimes they stay in the rural homes, and locally they cause minimal symptoms. Sometimes common krait bite person may not even know also. And person comes home, he dies. Many fatal sudden deaths are because of common krait bites. Last but most important, saw-scale viper. This is also similar to Russell's viper. It is very short and heavy, and skin be very, very rough. The scales are like a saw, and it causes tissue damage, lot of damage to blood cells, severe bleeding, and local symptoms can be very, very severe. Pain and swelling, blistering, and bleeding disturbances. Tissue necrosis immediately begins. These are also found in dry regions, scrub forests, deserts, rocky areas. When compared to Russell viper, saw-scale vipers are seen most in dry areas. In addition to this, you have a king cobra, which has a similar poison to Indian cobra, but this is less toxic than Indian cobra. But only problem with the king cobra can deliver large amount of venom. That's why it can even kill an elephant. Here you can see some photographs of viper bites. Photos I have copied from various sites. Thanks to them for putting nice pictures. See how the blistering from a saw-scale viper. Bleeding can come through gums, eyes. There are very, very serious local symptoms happen. Now why we are facing so many deaths all over the country? Because it is a public health challenge to handle a snake bite. Not even many medical professionals are in access to anti-snake venom. Neither many of us are trained how to treat a person with antivenom. You may be thinking antivenom is like any injection, just straight away you can inject. No. All antivenom injections are basically developed from the snake poison only. So they are also toxic to body in a very small doses. So a lot of people react to this antivenom, and they can even go into anaphylaxis. Anaphylaxis is a impending death kind of a reaction in the body. First is a limited availability of antivenom, and secondly trained manpower, and better medical facilities to handle. Mostly snake bites are delayed. We need to understand what you have to do immediately after snake bite. Get medical help immediately. The moment you spot a snake bite, first thing is you should call 108 or any local emergency ambulance number so that that person gets a medical help as early as possible. Firstly, it should be applicable to all bites because we do not know bitten by a non-venomous snake or a venomous snake. So best is to tell him to be very calm, reassure the victim, because mostly people run around and they increase the circulation. If at all there is any poison, it spreads very, very fast all over the body. So keeping the victim calm, reassuring is very, very important. And it should be for all snake bites until you decide whether it's a poisonous or not. You should limit their movement. Ideally, they should not jump around, walk around, run around, climb stairs, or drive vehicle. All these will increase their cardiac output. That means the more blood is circulated all through the body, and so the poison is also. So you try to immobilize the bitten area. Suppose your leg is bitten, don't try to move the leg. You should remove all tight clothing, tight pants, tight socks, jewelry. Keep the bite area clean. Do not cut the wound. Do not apply tourniquet or any tight band. Do not attempt to suck out the venom like a hero in a movie. Do not apply ice, cold or any pain-killing ointments. Do not spray anything. Do not give the victim alcohol or caffeine. Avoid elevating the bite above the heart level is very important so that not to spread to the heart very easily. Do not use painkillers like aspirin and ibuprofen and allow him to lie down calmly. Use a pressure immobilization bandage, especially neurotoxic snake bites, especially cobra and cranes. So ideally you apply a loose bandage around the area of the bite. Keep the victim hydrated because all these people will go into shock and to dehydration and renal shutdown. So it's important to keep the victim hydrated. Give him sips of water and also inform the hospital or the ambulance to keep the anti-snake venom availability. Why some people survive the snake bite? There are two things. Some people are bitten by a non-venomous snake. Secondly, sometimes even a poisonous snake may not kill a person because of dry bite. What is this dry bite? So basically sometimes snake don't want to waste their venom because it's after all it's food. If it doesn't have venom, it cannot stabilize the prey and cannot swallow it. Accidentally, if you spot a snake, what you should do? If you encounter a snake close by, stand still. Snakes have hardly any visibility. They can't hear you in any case. Any movement is a trigger for them to bite. So do not move. Do nothing. Let it go. If it's a viper, vipers do not run like other snakes. They remain in one place. They contract themselves and get ready to bite. So what you do, slowly step aside. But all other snakes, if they're passing by, do not move. You may talk because talking does not disturb the snake, and allow it to go. Do not try to pick it up or kill it, even if you're a trained snake catcher. If it has entered your premises, call trained snake rescuers. And keep on watching the snake, where it is going. If it is in your room, try to lock the room and keep watching whether the snake is escaping through windows or any other area. Do not allow people to gather around the snake because people will be moving, snake will get disturbed. It can cause unprovoked bite. Inform the rescuer if the snake escapes before rescuer arrives. Because if a snake is gone out of the house, our volunteer will come from far off place. There is no point wasting his time. And be very courteous to snake rescuers. These are not snake catchers. These are all employed, educated people with all scientific know-how, especially in Hyderabad, Friends of Snake Society. Most of the rescuers are very well trained. They do have equipment. They know how to protect themselves, to protect you. Be courteous to them. You will not kill the snake. At the same time, snake should not kill you. So let us respect the snakes and let us save human beings. I will be happy to answer all your queries, and please do subscribe this video and share it to all your friends, near and dear ones. Thank you very much.